The health workforce is the most important component of any health system since they design, manage and utilize available resources to deliver preventive, promotional and curative health services. One of the challenges to successful implementation of health programs in Uganda is a lack of better management and supervisory skills amongst health managers. But the introduction of the e-learning leadership and management program here in Karamoja region, it is expected that the gaps therein will be filled, thus improving the service delivery. It is often cited that there is a deficit of leadership and management skills at all levels of the healthcare service delivery. These health workers in Napak district are sitting their exams for the e-adaptive learning leadership and management program. When I interacted with some of them after the exams, they were appreciative of the idea.
I've learned a lot. Reason being, as an in-charge, I've never had the opportunity of having a course in management and leadership, because in school we are majorly trained on management of patients and other very basic management skills.
You know, being near, you can even first do other things in the facility before you come and do the course from here.
From time to time, they were teaching us computer as well as managerial skills in this course. So that's why I picked interest.
But for the implementers, Entra Health Uganda, this curriculum is vital.
It's basically about preparing a pool of adaptive leaders, people who can cope with the challenges of the health sector, the changing paradigms in the sector. Like, you know, there are many things that change in terms of technology, medicine and others, so on. But more specifically for it to be online, so that, again, people don't leave their facilities to go for purposes of study. And also to make a case that even in remote parts of the country like Karamoja, you can also promote technology and people study online.
And this is why they decided to start with Karamoja.
Karamoja has been disadvantaged in many aspects. They have not benefited from previous programs, and all the service indicators are low. We began with a cohort of 52 learners, whom I'm happy to say that we have been able to see through without dropouts, and they are enthusiastic about it. And these are basically managers at lower level facilities, Center 2, 3, and 4. We have a few exceptions for the general hospital.
The curriculum is designed with a number of modules specifically targeting areas of management.
There's what we call a tutor marked assignment, where a learner is asked some questions and he or she has got to answer them for a tutor to mark. Each module also has a quiz. This quiz has got a set of questions which are multiple. A learner answers these questions. After answering and submitting, they are automated. They are automatically marked by the system. The system records the highest attempt. For instance, if a learner attempts the first attempt and is marked out of 10, you get 5. Second attempt, you get 4. Third attempt, you get 8. So the system takes the mark of 8, the highest.
Before the e-learning program was developed, health workers had to make their way to the Human Resources for Health Development Institute in Mbale.
As far as dispatch is concerned, there is also a possibility of some papers getting missing. Some papers cannot be traced. But when we went to E is very flexible. It is very accurate. Nobody can deceive you, because in the paper, some people would even tell you that I submitted and there would be no evidence.
The senior health training officer here says this development will relieve the Institute of congestion.
Before we were using manual, we used to print papers, post them to the districts, and they submit to the health workers. They read through the material that we are putting, that we are bounded, and they're able to answer scripts that we also attach there, then send back to us and we mark. That was only allowing us to go to nearby districts because of transport. Actually, we're only training this region. In terms of numbers, we're only having very few numbers because it is costly in terms of moving transport to move all these units and for those people to be coming, even bringing materials here. We are taking mainly 40 to 35 per set. And in the last 4 sets, we train around 160. That was in 2 years, 160. And that was in 4 trainings.
However, they have encountered some challenges with the program.
That internet connectivity in this region is not so good, including power itself. And when to get solved, there are a few of those challenges. But we anticipated them because we knew the area we are targeting and its challenges. So in view of that, we make provision for some offline access to the course. Or if you're online, you can download and print some material for you to do.
Being supported by projects to have the IT on, but we haven't yet gotten our own IT as an institution here. We are basically now 3 here, but this program needs a bigger number of people because, you know, students get motivated when they see they have done a tutor marked assignment, it's marked on time, and they continue moving on.
While launching the policy guidelines on fighting sexual harassment last year, the Permanent Secretary in the Health Ministry, Dr. Diana Atwine, appreciated the introduction of the e-learning program.
Now that this has come, we are really going, I wish DG was here. This is something that we need now to discuss so that we have continuous medical education. Any information you want, just a click away, and you get. And you get this information, and you share. Here you hear, hey, hepatitis, we need to workshop. We need to get trained, workshop all the time. Everyone is moving up and down in workshop. But now that we have this e-learning, we are going to load all that information. Anyone who wants to learn, just call their people there.
Walter Mwesije, NTV.